An Alzheimer's patient is in the emergency center due to a mental status changes and is about to be transferred to Unit 6. She is only able to verbalize what the day is today and what her name is, but does not know where she is or how she got there. The patient can be combative at times, especially during increased stimuli. The nurse is about to prepare for the patient to arrive on the floor.
Hey Emily, I hear that we're getting a new patient in 607.
I actually just got done getting my report from the emergency room nurse. I'm looking at the lab results right now. Miss Luca should be up on the floor in 5 minutes. Let me just give you a little report on the patient, okay?
Okay.
I have that Miss Lukash is a mild Alzheimer's patient and is currently alert and oriented ×2.
Okay.
She can be combative sometimes, so you need to watch yourself.
Yeah, okay.
And I'm just finishing up writing her meds down and for when she arrives. Do you mind going in the room and taking out any extra furniture and turning off the television if it's on?
Yeah, sure.
Okay.
Okay, thanks.
Yep.
The nurse has just demonstrated the pre-interaction phase. The nurse is preparing for the patient to arrive on the floor. She took a report from the emergency center nurse, prepared the nurse tech, and delegated work to the tech to decrease stimuli in the room. 10 minutes later, the patient arrives to the floor. The patient is lying in bed with her eyes closed. The nurse knocks on the door and enters the room.
Miss Lukash? Miss Lukash? Vera? Hi, my name's Emily. Hi, I'll be your nurse today. Nice to meet you. I'm going to help you throughout the day, try to take care of you. Is there any particular way you would like to be addressed?
My name is Vera Lutzai. It's Lutzai, Vera Lutzai.
Okay, can you tell me what time it is and where you're at?
I'm at home, of course. It's November 17th.
Okay.
Oh, God.
Okay. Okay, Vera, here's your call light. I'll return in 10 minutes. I'm going to get your meds now. Are you able to swallow pills or do you need me to crush them up?
You figure it out. I don't know. I don't know.
Okay.
Hey Emily.
Hey.
I'm just about to go into 607 for some vitals. How's she doing?
Yeah, I don't think it's a really good time to go in there right now. She's pretty angry. I'm gonna give her some alone time and just to calm down, and then later I'm gonna go back in there and ask her what's going on. But for now, I'm going to ask if you don't go in there.
Okay, no problem. All right.
The nurse is in the orientation phase and is demonstrating a caring relationship. The nurse provided the patient with important basic information including her name, her title, and her role in taking part in their care. The nurse also provided the patient with the time available for their relationship. This information the nurse provides is essential in creating trust within the nurse-client relationship. The nurse asks the patient questions to determine the alertness and orientation of the patient. The nurse was able to effectively decode the patient's nonverbal signals that indicated she is mad and very upset, and gave the patient a couple minutes to herself before figuring out the root of the problem. However, a barrier is evident when the nurse left the patient's room for 10 minutes knowing the patient was upset. This displayed mistrust within the nurse-client relationship. Another barrier, lack of respect, is evident when the patient perceived the nurse as disrespectful and unfriendly. The nurse continues the introductory phase when she returns to the room.
Miss Vera, I'm back with your medication.
I don't want my medication. Go! Go! I don't want my medication. Do MR. I'll stop.
All right, Miss Vera, let's have a chat, okay? I understand you're very upset. What's going on?
Get away from me. I don't understand why I'm here. Stop here. Let's go against you. I'll stop. Let's stop. Get away from me. Get away from me. You're so mean and disrespectful.
Vera,
Stop here.
calm down, Jessica. If you could wrap her IV site after you insert a new one, and after that, call her son, okay?
I'm going to write you an order for restraints.
Okay, before you do that, I really want to just make sure there's nothing else we can do before we resort to that.
She's harming herself and others. Why are you hesitating to receive this order?
Because, I want to avoid the adverse reactions of restraint use, I want to make sure that we can do everything before that, just before we resort to that.
All right, then. We'll call me things strange.
Okay, thanks.
Did you say that my son was coming?
Yes, Miss Vera, would you like that?
Oh, I like that very much.
Okay, Miss Vera, we're gonna have a little chat, okay?
Okay.
I need you to take a breath, okay, and calm down. Do you think you can restrain from hitting me?
Yes, I'm sorry.
Okay.
I'm sorry.
Now, Miss Vera, I've been where you have been. Once my blood sugar was really low, I passed out, woke up in the ER, didn't know where I was. It's frustrating not knowing where you are, you know? So I completely understand. And the last time you seemed to lose control and get angry and start hitting and swinging was at home with your son.
Well,
So-
I never hurt my son. I love my son. I love my Chris.
I know. So that's why we're going to work together, and I'm going to try to help you the best I can. Okay?
Yes. I'm sorry.
And I'm going to try to figure out what the underlying problem is. So do you want to help me?
Yes,
with
I do.
this?
I do.
All right.
Yes.
Okay, now I'm going to go get your medicine. We're going to try giving you your medicine, okay?
Okay.
Okay?
Thank you.
Yes. Miss Vera, it's me, Emily.
Yes.
Okay, I have your medicine, but before I have you take it, I want to have a talk with you about it, okay? We're going to change it. We can either increase the dose of the medicine you're on, or we can try a new medication altogether. Which would you prefer?
I like the other one. It was stronger. It helped me before. It helped me now too.
Okay, so you want to increase the dose?
Yes. Yeah.
Okay, so I know the talk we had before was very emotionally exhausting, right?
Yes.
So this pill is pretty large. Would you like me to crush it up and put it in some applesauce for you?
That would be good. That would be good in applesauce.
Okay.
Yes.
The nurse continued with the orientation phase. The nurse displayed a nonverbal communication technique when she lowered herself to be eye level with the patient. Through the nurse's observation and interaction with the patient, the nurse was able to make inferences regarding their immediate needs, and these needs were then established and verbalized. At the end of this phase, the nurse was able to develop a goal for both the patient and herself. The nurse then began the working phase, in which the nurse started to diffuse some challenging behaviors. The nurse was able to effectively tolerate the anger of the patient by displaying the verbal technique of self-disclosure. The nurse intentionally shared a personal story that was similar with the patient. Nurse's use of self-disclosure ultimately facilitated the nurse-client relationship, and the patient felt comfortable enough to discuss her feelings. The nurse was also able to inform the patient what behavior needed to change and how to effectively change it, along with empowering the client to making decisions in her own care. This empowerment, followed by the caring and respect shown to the patient throughout this phase, are bridges to a positive client-nurse relationship. Another nursing action that showed a bridge to a good nurse-client relationship is when the nurse displayed a verbal and a nonverbal communication technique of empathy, but understanding where the patient was coming from. When the nurse told the patient that she was going to work together with her to figure the problem out, is considering maintaining belief when referring to Swanson's caring theory. The nurse demonstrated knowing by sharing her similar story. The nurse also demonstrated being with by actively listening and absorbing what the patient was reporting to her. Doing for was demonstrated from the nurse crushing the medications in the applesauce for the patient. Enabling is actively shown after explaining the goals to the patient and focusing on generating alternatives and thoroughly thinking it through. The nurse continues through the working phase and then ends the relationship with the termination phase.
Hey, Miss Vera. Hi. How you doing? Okay, here's your meds and your applesauce, and I also have a little surprise for you.
Oh, my
I'll leave
son.
it
I'm
to
so
alone.
sorry.
It's okay.
So sorry,
I love
my
you.
son. I love you too.
I'm just glad that you're here. We can get through this. They can help you, okay?
Yes.
I know Alzheimer's can be scary and confusing, but we're here. I love you.
I love you too.
Hey, it's me, Emily. I just wanted to come in and let you know that I'm leaving in about 10 minutes. I had a good time working with you today. Can I get you anything before I leave?
No. Just thank you very much. I appreciate everything you do for me. Thank you.
Oh, hey, this is Jessica. Do you remember Jessica?
Yes, I do.
Okay.
Hi.
Yeah, she's going to be your nurse tonight, okay?
Yes.
All right, and you said you didn't need anything?
No.
No? Okay.
I'm gonna sit and watch reruns of Grey's Anatomy.
Grey's
Yes.
Anatomy, okay.
Yes, reruns, yes.
All right, enjoy.
Yes.
Bye
Thank
now.
you, thank
Bye.
you, yes, thank you. Yes.
At the end of the nurse-client relationship, the nurse was able to enter the termination phase by saying goodbye to the patient. The nurse evaluates the progress of the evident goal at hand, together with the patient. The nurse reminisced with the client about the relationship they had throughout the day. The nurse also created a smooth transition for the client to other caregivers. Finally, the nurse demonstrated effective verbal care toward the patient before leaving her shift.